We've already turned down the rate on your ventilator, so you've been doing quite a bit of the breathing on your own. Your heart rate and blood pressure have been really stable, and your oxygen saturation's been great. So we're going to move on to the next step of weaning now. This is our respiratory therapist, Lily.
Before removing a patient from mechanical ventilation, a number of criteria must be met. Heart rate, hemoglobin, blood pressure, and blood gases must all be acceptable. The primary medical condition must have stabilized. The overall condition must be optimized, and the patient must be ready psychologically. And you must be certain that there's enough cardiopulmonary reserve to maintain spontaneous ventilation. Here are some guidelines. A vital capacity of 10 to 15 milliliters per kilogram is ideal, but patients with chronic conditions and normally low vital capacities may do well with less. A spontaneous resting respiratory rate of less than 30 breaths per minute. The ability to generate an inspiratory force of at least -20 to -25 centimeters water pressure, and the ability to double the resting minute ventilation on demand.
Good. I'm going to hook you back up to the ventilator now. You did really well. I'm going to go and get the equipment, and we're going to get you on T-piece.
Great. I think you'll be a lot more comfortable. Do you feel ready? Okay. I'm going to disconnect you from the ventilator now and place you on the T-piece. You'll be breathing on your own, but it will be providing you with humidified oxygen.
Patients can be weaned from the mechanical ventilator using a variety of techniques depending on the underlying condition, the length of the time they were mechanically ventilated, and clinician preference. The patient may be given humidified oxygen through a T-piece connected to the ET tube. The patient is still intubated but is breathing on his own. Other patients are weaned as the rate of mandatory breaths, or the amount of ventilator breaths, or the amount of ventilator pressure is gradually reduced. Regardless of the weaning technique used, the patient's closely monitored and given ample emotional support. It's not uncommon for the patient to feel anxious and to experience shortness of breath at first.
Look like you're getting a little anxious. I want you to just try to relax and take slow, deep breaths. And be monitoring you very closely. I'll be watching your heart rate, your respiratory rate. I can see your oxygen level on the sat monitor at all times. So just breathe nice and slow and deep and relaxed. I'll be here through the whole process. Good. That's better. Very good. We'll be checking a blood test in about a half hour. That's the next step. Very good.
If the patient is not tolerating the weaning process, you may see a respiratory rate greater than 30 or less than 8, or an increase in 10 from the starting respiratory rate. Other signs include agitation, diaphoresis, nasal flaring, paradoxical motion of the rib cage, a change in heart rate by 20 beats per minute, dysrhythmia, or changes in oxygen saturation.
Just breathe nice and slow and relax. Feels a little different, I know.
If the ABGs are good and the patient's doing well after a predetermined time or a number of trials, the patient may be extubated.
You have really improved since yesterday. Your room is ready downstairs, and they'll be here soon to take you down in a wheelchair.
You were wonderful, really. I really thank you very much.
Oh, you're welcome.
Yes, thank you so much.
You're welcome. Now make sure when you get down to your new room, you continue to do your breathing exercises.
Oh, I promise, really.